you so much for tuning into my channel. My name is Ashley. So this video is going to be about my second year as a registered nurse. I made a video about my first year as a registered nurse, and that video has the most views out of all the videos on my channel. And when I made that video, that's when a lot of people started subscribing to me. So I decided to do a follow-up video with my second year as a registered nurse. So I celebrated 2 years of being a registered nurse on July 6th. So I now have 2 years of mother-baby experience. So I would describe my second year as a registered nurse in one word. I'd probably say growth. I have grown a lot since my first year as a registered nurse. Of course, I'm still learning and everything like that, but I can tell that I've grown since my first year as a registered nurse. I have my own routine down. Of course, with more experience comes more confidence in your skills. But of course, I asked the other nurses questions. This year I also got an award at work. At my hospital we get a Great Catch Award. A Great Catch Award is something that is given to a nurse if they catch like a patient safety issue. I picked up a second job at a pediatric clinic. So I work at a pediatric clinic part-time. So some of the things I have to do at the pediatric clinic, I check patients in, so I get their vital signs, I get a weight on them. Some patients might require a throat swab for the strep test, a flu swab. I might have to give a breathing treatment, do ear washes. I might have to give antibiotic shots. So those are just a few things that I do at the pediatric clinic. And also we're working with different ages of kids. So those developmental stages that you learn in your pediatric nursing course, they definitely apply to my pediatric job. So you know, when I do a throat swab or a flu swab on like a kid that's in high school, you know, they usually let me do it because they know that we're trying to see, you know, whether they have strep or flu. But you know, if you try to do the same test to a child who's like 5 years old, of course they're gonna be kicking and screaming the whole time. So I definitely love working with kids, and it kind of balances out my life, you know, working at the hospital, doing mother baby, and then doing pediatrics part-time. I definitely love the balance, and it also shows me a different side of nursing in the aspect of it being in a pediatric clinic setting. So I thought it would be a good idea. I thought I was going to do like maybe like 5 things that I've learned from my second year as a registered nurse, but I thought that it would be a little better to do like the pros and cons of working bedside nursing versus clinical nursing. So the pros of bedside nursing, I would say the first one is that you only have to work 3 days a week. So usually when you're a nurse in a hospital, you only have to work 3 days out the week. Well, as far as my hospital, we only have to work 3 days out the week. So you get 4 days off. So you can plan a vacation without having to take any days off. You get 4 days to rest. I just love only having to work 3 days a week. So the second pro of bedside nursing is better pay. I take a pay cut working at the clinic, and that's okay with me, but you're more likely as a new grad to get a job in the hospital versus the clinic setting. Now that's not to say that as a new grad you can't get a job in the clinic setting, but I know with my pediatric job they wanted you to have experience in pediatrics. Now to the cons of bedside nursing. The first one is that you have to work holidays and weekends because you guys know that hospitals never close. Second con of bedside nursing would be 12-hour shifts. Now if you've never worked 12-hour shifts, let me tell you, 12-hour shifts can be very long and very draining. And I say the third con of bedside nursing can be the charting. Now the charting that I do at the hospital compared to the charting that I do at the clinic is a lot more. So I have a lot more charting to do at the hospital, and it took me a while to learn our charting system at the hospital compared to the charting system at the clinic. So some pros of working in a clinic So the first one will be at some clinics, they're not open on the holidays or weekends, so that means that you wouldn't have to work on the weekends or holidays. But I know there are some clinics that are open on weekends and on the holidays, so it just depends on your clinic. So the first con will be not having to work on the weekends or holidays. The second pro of working in the clinic, I say it's more of a low maintenance job compared to my hospital job. That's not to take away from my clinic job or say, you know, hey, clinic nursing is easier than bedside nursing, because each job, you know, you're going to have your good and bad days. But at my clinic job, mostly I'm only just having, like I stated earlier, just to like check patients in. And after I check them in, if they don't require any type of procedures, you know, the doctor usually sees them and, you know, assesses what's going on with them. And after that, you know, they're out the door. Unless they like need an antibiotic shot, a breathing treatment, or anything like that, you know, my job is pretty much done with them after I check them in, unless they require a procedure. Third pro is that I only have to work a few hours a day, because it's only a part-time job compared to, you know, I work 12-hour shifts at the hospital. So some cons of clinic nursing. So the first one is that you'll definitely take a pay cut, because like I stated earlier, you know, I get paid more working at the hospital versus working at the clinic. Second one is, in my opinion, working 8 to 5 if you're a full-time clinic nurse. Now, some people love working 8 to 5, but when you're used to only working 12-hour shifts, so just 3 days out the week, you know, working 8 to 5 Monday through Friday just doesn't seem as good as only having to work 3 days out the week at the hospital. I definitely love both of my jobs, so they balance each other out, and I get to see a different side of nursing with each job, and I learn so much at each of my jobs. I hope you guys enjoyed this video. I'll definitely be doing a follow-up video each year about my experience as a registered nurse. You guys can follow me on Instagram at prettynurseashley. You can follow me on Twitter at prettynurseash. If you have any questions or comments, leave them below. If you're a bedside nurse or you're a clinic nurse and want to give your input, definitely give me feedback. Also, if you like need advice or anything like that, my email is prettynurseashley@gmail.com. I hope you guys enjoyed this video. Make sure to like this video, give me a thumbs up, and subscribe. Thank you.